When I first started dental school, I, like most of you watching, wanted to place dental implants. And I was trying to get a piece of that oh so sweet implant pie. Yes, you've heard of dental implants being the future of dentistry. They're extremely lucrative, they're super quick and easy at $3,000 a pop. In the same time, it'll take you to prep a few fillings. But how do we learn this procedure that will make our lives as dentists easy and filled with tons of cash? Let me introduce you all to the field of periodontics. I think all dentists and dental students go through this specialization carousel. And my dental journey started with the dream of one day being a periodontist. It really seemed like the best way to be prepared to start doing all-on-fours and full mouth reconstructions, so I was very eager to get into the field. But is perio really as hyped up as dental school claims it is to be? Are you really mainly doing oral surgeon level work without having to do OS residency? Furthermore, will you have good job stability? Will you be able to make bank and do all the fun surgical procedures that you want to? Well, we'll talk about all of this in today's video. And if you stick around till the end of the video, I'll offer my insight on if it's really worth it to pursue perio as a specialty. All right, first off, let's talk about salary. ZipRecruiter has the average periodontist salary at about $225,000 per year. Guys, that's a ton of money. And I think we as dentists get a very skewed perception of money and earnings since we're automatically in the top earners of the world. But compared to the average American, it's an incredibly comfortable lifestyle at $225K a year. And it's more than the average general dentist does at around $175K per year. I personally know multiple periodontists who do well above this number, closer to the $350 to $400K mark, with much better work-life balance at around 4 days a week. But they're all well into their careers and they aren't the most normal types of individuals, if you get what I mean. But if you go rural, as a perio, the numbers really start to open up at 400 to 500K. So there's definitely demand if you're in the right location. But you need to do an extra 3-year residency at the cost of $200,000 on top of what you already paid for with dental school. That's a pretty hefty sum of money. And this should put you over $500,000 to $700,000 of debt to become a periodontist. So how does a periodontist generate so much money anyways? And is it worth this crazy level of debt? So what are the types of procedures periodontists are actually doing? As I learned more about perio, the procedure mix that they were doing on a day-to-day basis was quite shocking to me. Number 1, dental implants. Finally, what we all want to do, right? Well, periodontists place a lot of implants, ladies and gentlemen, and they are the major source of revenue for periodontists. If you don't know, these titanium posts are surgically inserted into the jawbone to replace missing teeth. And not only are periodontists good at implants, but they're also good at creating ways to augment the bone to place the implants by doing bone grafting and sinus lift procedures for successful implantation. Secondarily to implants are several different types of gum procedures which are being performed daily. And I didn't realize how much of their daily scope consisted of this until I started to shadow them. I thought it was just all about implants. And if at some point you thought this, you are sadly mistaken. Periodontists do aesthetic gum procedures to improve the appearance of the gums and enhance the overall smile. This may involve reshaping the gum line like a gummy smile correction. They also perform gingivectomies to remove excess gum tissue or treat periodontal pockets caused by gum disease. Also, connective tissue grafts and free gingival grafts are done too to treat gum recession and improve gum tissue thickness. These procedures involve harvesting tissue from other areas of the mouth, like the roof of the palate, to graft it onto areas of recession to cover exposed tooth roots and enhance gum aesthetics. I see it going towards more peri-implantitis cases. With the rising popularity of dental implants, there has been an increase in cases of peri-implantitis, which is inflammation and infection around dental implants. When more young general dentists with lack of clinical training jump into implants, there are going to be more surgical complications. And now it's becoming easier for young dentists with little surgical experience to come out and place implants with the increased usage of surgical guides and CBCT technology. But there is a steep learning curve to all of this because it is facial jawbone surgery. Peri-implantitis cases are surely on the rise, especially with overall general public awareness about dental implants increasing. And perio may be getting the majority of the referrals here for this. Okay, so you know they make great money and they do a lot of cool clinical stuff, but how competitive is it to be a periodontist? In my experience at NYU, the path to becoming a periodontist appeared less competitive compared to the other specialties. All right, they were pretty much begging students to join the specialty program at my school. It may sound harsh, but why would I say such a thing? It's over another $200,000 for a 3-year program. These institutions love your money and blank checks handed out by the government, and Perio is a great example of it. These programs are so theory focused that it's almost laughable. Essentially, the program mainly focuses on reading research articles, journal clubs, and conducting case presentations with limited practical experience until the latter half of the 3-year residency. And you're most likely not even placing implants in the first year of perio residency. Tell me if I'm wrong in the comments below. During this period, you're not earning an income, but instead, you're going into more debt. And the opportunity cost here is substantial when you subtract the lost general dentist income. I initially thought I could do perio and be like an OMFS junior, but this couldn't be farther from the truth. The surgical expertise between the two doesn't even compare. Comparatively, the amount of clinical hours logged for perio for 3 years is roughly 6,000 hours during your 3-year residency, with OMFS residencies accumulating between 18 to 19,000 hours over a 4 to 6 year residency. The difference is substantial, which brings me to my next point that's going to be quite controversial. So if this makes you feel some type of way, let me know in the comments below, or if you want to roast me, share this video in your dentist group chat. It's important to acknowledge the future challenges facing periodontics as a specialty. New technologies being adapted by the masses, making dental implant placement easier than ever before. CBCTs, surgical guides, CE courses are all now extremely accessible to the general dentist. These innovations have streamlined the implant process. So my overall stance on the matter is that periodontics may not be as lucrative as it once was, and the field could be on the decline. Just look at some of the posts that are coming up online. While there will always be a demand for specialists in underserved rural areas where access to care is limited, the landscape is surely shifting. Just about every single dental student and practicing dentist in the world is increasingly focused on dental implants, recognizing their profitability and demand among their patient population. With this trend, there is growing competition for share of the dental implant market, primarily dominated by general dentists and oral surgeons. As a result, I anticipate that periodontists may find themselves squeezed out of the market just a little bit, particularly in urban and suburban areas where the competition is fierce. Unless they're willing to travel extensively or settle in rural areas, periodontists may face challenges in maintaining income levels that were once seen a decade ago. Now, to play devil's advocate, yes, periodontists excel in managing soft tissue, a crucial aspect of successful implant outcomes. I know if I want the tissue of an implant to be handled well and not obliterated like some oral surgeons tend to do, I'd send an anterior implant possibly to a periodontist. However, in my experience, I rarely refer patients to a periodontist, and even for severe cases of periodontal disease. I'm talking a handful of times in my career, and this was even more evident when I worked for Aspen Dental. To put this in perspective, Aspen Dental's entire business model is to open up shop in rampant perio population. Yet all the complex periodontal cases were managed in-house. Hygienists often perform procedures typically associated with periodontists, like scaling and root planing, with the use of antibiotics like Arrestin in deep pocket sites. The use of Arrestin and how it generates profits for the company is like a whole other topic for debate. Chat, let me know what your thoughts are on Arrestin in the comments below. But moral of the story is, the company doesn't even hire periodontists. Think about that for a second. The only two specialists hired are the pain specialists, OS and Endo. And why would DSOs in private practices hire periodontists anyways, if they can get an oral surgeon who is more trained to handle complex cases and is also able to sedate the patient? If there isn't a job market within DSOs, then the future job security needs to be seriously considered, because DSOs are only gaining traction. I, as a GP dentist, am rarely referring to a periodontist, as I do all my own surgical procedures. If I ever feel uncomfortable doing something, I can always refer to my senior GP doc to do it for me. And even then, rarely do cases get sent to an oral surgeon for implant. And perio? Nah. If there is an extremely tricky case of recession in the anterior aesthetic zone that my senior doc doesn't want to graft, then yes, it'll go to the specialist. But it's also extremely expensive to have these procedures done. And many patients in my patient population reject these types of treatments altogether. If your career aspirations gravitate towards mastering intricate aesthetic gum procedures, tackling challenging anterior implants, implant cases with literally no bone, or you want to do specialized complex bone grafting procedures, then a career in periodontics may be right for you. The patient demographic that I serve rarely requires these extensive aesthetic gum grafts, and I handle most of my implant surgeries as a general dentist, only a few years out of school. With advancements in technology and access to information, the need for external referrals to oral surgeons even has diminished. Reflecting on my journey from aspiring periodontist to practicing general dentist, I've come to appreciate the breadth of surgical capabilities within general dentistry. My big bro is an all-on-X GP in New Jersey, so seeing him do all these full mouth cases guided really opened my eyes to the opportunities available as a general dentist, focusing on surgical prosthodontics. Therefore, I encourage you to consider your own aspirations and experiences as you navigate your career path. Do you want to run a massive hygiene clinic as a periodontist doing gum grafts and tricky implant surgeries all day, while the GP is doing all the slam dunk cases and is able to restore them too? Maybe I'm just crazy, huh? But tell me what your thoughts are on periodontics in the comments below. Or if you've made it this far, hit that like button. I'll catch y'all in the next one. Dr. Rana here, signing off.